Dr. Justin Lin of Rehab and Revive Physical Therapy here in Tustin, California. Today we have my lovely assistant who's been dealing with some sinus issues, changes in her voice and tone, also noticing some things. She's going to talk a little bit more about what she's been dealing with over the last couple years. I wanted to help her out and make a video out of it. So let's get started. This is Michelle, and so go ahead and tell me a little bit more about what's going on. Then I'm going to talk about what we're going to do next to help you out.
I've been getting headaches kind of constantly right here, like at the corners of my head. And I get sinus drainage that I've always had ever since I was...
Since you can remember?
I can remember.
Okay.
When I have sinus drainage, my voice changes a lot.
So are you having some changes now?
Yeah.
Okay.
You're
not sick, are you?
No.
Okay.
But that's about it. So headaches, the sinus, and the voice change.
Yeah, so we got something really neat here through my mentors, Vicki Johnson and Greg Johnson over at Institute of Physical Art, applying functional manual therapy. I just got certified recently, one of 220 around the world internationally. So I wanted to apply this. Michelle's been seeing me do this, and she was kind of curious about it. So I wanted to show you and show the rest of the viewers what kind of difference we can make. We can make difference in adjusting things. So I have my skull, little here. There's about 26 different bones here in the skull, and all these pieces, instead of preconceived or what people used to think used to be all fused, they actually move. There's things such as sutures, and that's what I'm going to be trying to help move and kind of get into a more flush kind of surface. So we want to get these things to move and expand. Sometimes people that get headaches usually have these sutures locked up, and so I like to think of a bridge out in the East Coast. When it starts raining or it gets cold and snows, the bridge, the concrete actually starts to kind of they contract. So then the locks have to come closer together, and then when it gets hot or you're stressed out, the locks have to get and move apart, so the concrete expands. So a lot of things very similar happen to our head, and so I want to get these things moving. The sinus is actually interesting. There's a sinus around your maxilla, Michelle, and behind, in front of what we call your sphenoid. Once we get to that, I think we're going to notice some changes, and then we're going to kind of work down into the jaw a little bit as well. I think this is something great. A lot of people have been coming to see me. I have some models and people that act coming to see me, trying to get their face, we say face, kind of mobilized, and so I call that aesthetic physical therapy. So stay tuned. We're gonna focus in on Michelle's face, and you can kind of see how her right side is a little bit more depressed and deviated. There's also changes even in her face with some, I hate to point it out, but some acne and facial endocrine stuff. I think just because when things are dysfunctional, you tend to build more acne. Circulation is poor. That's one of the thought processes. The fluid exchange on the surface of the skin doesn't happen as much. So we're going to look at her. Maybe we can take some years away as well as help her function, which is really why you're here, and really help the sinus. And so we're going to do a couple tests before. I wanted to take a look here. And so is it
TMJ too.
Oh, and people with TMJ, that's great. Yeah, thanks for reminding me. People with TMJ come here to work on getting these things aligned, because the jaw needs, when you chew or you compress, it moves these and shifts these bones around. So once we get these in a little bit better, the jaw then starts aligning itself a little differently, and then you have a little bit more straighter tracking is what we call it. So that's great. And so I'm going to take a look here, Michelle. I just want to hear kind of how you since you said there's some voice changes, I'd like to hear it a little bit more. Just have you like over here, open mouth, hum or huh, like or and you can kind of hear, I don't know if you can hear it on the microphone, but I can hear that there's more, it's more full here, her voice. And then over here, it's kind of like cracky. Try to do it a little longer and your whole breath. Yeah, it's kind of raspy on this side. I don't know. I'm trying to center the microphone, and hopefully you can hear it out in the viewership. But you know, it's something we want to try to help square away with the sinus. Let's do your breathing too. So I don't know if people can hear it, but I want to have you close one nasal passage and just breathe in and out. Okay, good. You want to look for any interruptions, any weird kind of fluid or anything. Let's hear on the right, her right side. And you can hear it's tougher to breathe on that right side. So a lot of things I already can see on her face. Let's actually take a look at her face here and then see if that's okay. Yep, you can zoom in and you can kind of see if I kind of block this half here for you folks, you can see that's like probably the way she wants her face to be, right, Michelle? And then on this side, there's, like I said, there's that changes in her skin. The eye level's a little bit more depressed. If I put my finger here and then put my finger here, you can kind of see that this side's a little bit more elevated. Let's open and close your jaw. Okay.
It's hard to open.
Yeah, and it's harder to open on that right side too. So you can see maybe it tracks. Let me see if it tracks differently. Yeah, so it kind of tracks just a little bit. So it's not as significant as some of the patients that come here, but these are the things that we really can make a difference and make a change. So we got that, and then just a side note, I like to do some interesting tests to show the integration of the head and the rest of the system. Let's look at your shoulder motion. So right over here, stay right where you're at, Michelle, and then right here. You can see that if I block here, I can only get this high. And then on this side, if I block here, I can get a little bit higher. So I would say that's about 130 degrees on this side. So we want to see if these things make an impact on the rest of her function, which I'm going to make a hypothesis. I think it's going to happen, and she's going to do a lot better. She's going to breathe better, and the jaw tracking and the sound production of her voice is going to be better. So Michelle, I'm going to have you lie down, and we're going to position you for some treatment, and then I'm going to talk things through. We're going to kind of engage the viewership here as well. So have the camera come a little closer, all right, here, and we can kind of take a look at her face as is in neutral already. So so functional manual therapy. With the use of functional manual therapy, so you can actually see her head is already set this way. Her jaw is almost deviated this way already, and her eye level's here. Her nose kind of goes that way slightly. So these are the things we want to look for change. So for those of you wanting to change the way you look a little bit, or even people going for weddings, I have people coming for weddings and wanting to look better in their wedding photographs. So. So we're going to start here. I'm going to take a look at her fascia, and let's talk about that. We want things to move. Areas that generally have more blemishes, they just don't move as well. And so, just let me know if there's any discomfort. Some of this stuff is uncomfortable, but just letting you know, Michelle. And so right over here, I'm just going to kind of start working on some things quickly while we talk about the craniofacial therapy and the cosmetic, and as well as if some singers. I have some vocal coaches that have come in the past to work on their voices, because a lot of these things get strained. There's a lot of stress and strain there. So I'm just trying to mobilize some of this fascia. The fascia is a superficial layer, or the top layer of our skin, and we want it to move. Just think of a sweater getting snagged against something like a wired thorn, or a thorn out of a door frame. A splinter, you get caught. So just imagine these things impeding on the way bones, joints move. There's a lot more research and science going towards this, and so this isn't a bunch of this isn't a bunch of what was I trying to say? This isn't some quackery stuff that's out there that you might see regarding anything aesthetic. I'm gonna have you open and close your jaw, and so I can feel on this side, and you can kind of take a look here that it pokes out a little more. So I'm gonna have you open and close, and this actually presses. I can feel, you can actually see there's more excursion here, and it presses. In a perfect world, her jaw should be able to roll down, hinge open, and then drop down. So those of you interested in TMJ as well, this is something that, you know, we're going to work on. There's a sequence, a flow I follow, and I adapt that from functional manual therapy, so I have to give credit to that and my mentors. So I'm just trying to free some things up first, and then I can start moving some of these sutures or part of these bones, and she's going to tell you she probably
tight in this area.
Yeah, and that's you know, a common thing. You know, like I said, I love when people work on my head, so I get really excited about this stuff. So we're just telling you what I'm feeling, some tighter muscles here, and so we're going to try to start working around here as well in a minute. I'm going to get through the back here, and you know, who doesn't love this? How's this feel?
Feels so good.
Yeah, the suboccipitals, a lot of people. So we're just we're doing some manual techniques over the soft tissue first. Great. And so we want things to be mobile. Her scalp should move nicely, and on this side doesn't move as well. So this side moves nice, and so you never know. Sometimes, even though she has this right side dysfunction, how's your sinus draining right now? Is it kind of...
It kind of happens a little more often since it's raining.
Yeah.
December.
What about laying on your back?
When I wake up, sometimes you can tell I just woke up because my voice will be really cracky.
Oh, so yeah, so it's kind of the sinuses drain to the back of her throat. It's interesting because people sometimes don't know that the pharynx, we have an oral, a nasal, and the main pharynx. So there's 3 passages that change our voice. So we need all these things free: our nose, our mouth, and our throat. Okay, good. Now we're going to do some things here. So what makes her head, what creates some of these things? Some of these headaches sometimes come from nerve tension, the soft tissue. If you had post-concussion as well, a fall on your head, knocked your head, bumped your head, any way, shape, or form, that's a good way. So I found a tight spot. How's that feel right now? A little tender, right? So I can have her move her eyes side to side. Okay, good. Good. Every time she, you have this facing me. Yeah. Every time she looks to the right, it just tightens up. Do you feel that? Yeah.
I did have a mild concussion last year.
Oh, you had a mild concussion last year. Which side did you hit?
I don't know. I can't remember.
I would probably say this side. I wish I saw her before, and we had maybe before concussion, but concussion does some very horrible things to our head, our brain, and just the nerves that get wrapped around our head. So we really want to make these a lot more efficacious in the way these bones move, and more efficient. So I'm going to have you bend your knees a little bit. Yep, go side to side. Yep. And every time she goes to her, yeah, you can feel that every time you go to the left, right? Or the right, actually, it's to the right. Yeah, it's the right, yeah. And it feels more. There's some to the left, but I'm looking for something that's going to make a big change. It's all about the wow factor for you folks out in the YouTube world. So I got to make some wow happen. Real life. No computer graphics, no CGI. This is all real time. Good. Now it's starting to free up. And this is great. You know, functional manual therapy is the wave of the future. You got to find yourself a functional manual therapist, someone that does this. And like I said, certification takes about 5 years. Let's go do this again. For me, it took about 5 years. I tested out. Very rigorous test. One of the hardest tests of my life. But in the end, it's worth it. I have so much more skills than I ever could to help patients, and I'm so happy to help the patients that come in here, and so blessed to be #1 in Orange County 3 years in a row. So just my little my little blurb. Good. There we go. So I'm just trying to get, like I said, these sutures a little bit more flush to the rest of her bones. Good. And so it's a firm press. I'm not, it's a firm, right? You feel comfortable, but it's going to be tender. And that's what it is. When I get to the jaw, it's probably going to be less comfortable. I kind of rate that as one of the top 3 areas that kind of more tender to most folks. So, yep, I'm moving on to the next spot, which is behind here, and then so we were always looking for some areas of tension, and on that right side, boy, she really needs that side so she can compress for some time. Go ahead and go to the right and left with your legs. Good. And you can see the reason I'm having her move her legs is we call this tensegrity by Buckminster Fuller, who kind of coined the term, and it just wraps our body's just all connected. The fact that this world is headed the way it is, unfortunately, in our medical system, it's unfortunate. They're killing us on insurance. They don't believe in the art of manual therapy. You could also check out my recent book. I wrote a new book out here on Amazon and Kindle. It's called Rehab the Mind, Revive the Body, Foundations of Healing. It's anecdotal stories about awareness and adversity and obstacles, as well as my own personal stories. More story-based, less science, but you can always reference the science. We're trying to promote more of the holistic health and the mindset. I think that's just one of the most important components of what we get to do here as physical therapists, as manual therapists, as healers, as some of you guys would like to call us. Good. So I'm starting to kind of wrap myself around looking for these hard edges. If you rub your head and you kind of see these hard edges sometimes, these are the things, it's not right. It's like fault lines. We live here in California, like the San Andreas fault line. These mountains here in Nevadas, they get, when they get crushed and there's no room, then we run into trouble. Our body's always trying to vie for space, right? And that's been kind of your issue here, Michelle, right? You've been wanting space. Your sinus needs to expand, and it's not going anywhere. Then it creates like a local inflammation as well. So, how's your breathing so far?
Can I do this?
Yeah, you can try it. I'm not fully done yet, but... How's that?
The exhale is better.
The exhale is better? Okay. We're just kind of in the middle of all this so far, so let's see how this all... Right here, it's going to be tender right here, right? I've got a good firm, hard grip here. Go ahead and just go side to side with your legs. Yeah. So this is the future of manual physical therapy. I think the patients here are really satisfied. It's a very direct method, so some people that are a little bit more sensitive, it's probably not for you, but I always say it's worth a try. There we go. Good. Awesome. Great. Now it's trying to free up. We're always looking for springy. Springiness is when things are a lot more efficient here. So I'm going to check if there's springiness here on this bone. Call this the mastoid process, and this side's really stiff. Let's do the same thing. You can just do some breathing. That's also a good way to kind of, you feel that compress, right? People don't realize when we actually do respiration, that our head actually expands a little bit too. You should put your hand on your head, everyone at home, and take a deep breath. See if it expands. Guess what? It does. If you're really sensitive to it, you can really feel it. And that's my job, is to be really sensitive to it and work on it. Like I said, good. Breathe. And you feel right there, right when you take that breath, it pops into my fingers. Good. Good. This is not as cool as the shoulder shoulder video that's been going viral, but you know, subtlety and specificity is key to this art, and I've done this so many times. I can talk while I'm working and feeling at the same time. So right here, so we're gonna get right here, and right here on the top of her head, that sagittal suture, boy, tender right here, right? Yeah, I'm gonna try to find the hardest one, but really I think check that out. So I'm gonna have you do this for me. Like I said, we're always trying to imply and make function happen. So good, that's good. Open and close your jaw now. Yeah, you feel it up here? Yeah, good. Yeah, there we go. Okay, that's pretty good. That's really good here. All right, go ahead and sit up quickly before we kind of move towards the jaw. But let's see how you are, how the face looks, and even some of these pre-tests that are. So how are you doing? Go ahead and do the humming. How does that feel to you?
It's more
resonant,
less, foggy. I like.
Okay.
The hum. It sounds less. I don't know if the words are for it, but I'm clear.
A lot more clear. Yeah. There's less.
I just maybe can't hear it, but I can hear it in my own ear.
The raspiness.
Yeah.
Sure. And then do the breathing again. And that's even a lot more powerful of a breath than she was getting earlier, at least from what I noticed. Oh wow! Look at that. I'm gonna stick the microphone here. It's gonna be weird, but yep. Do that again. That's awesome. That she can have that. Yeah. So let's actually go a little further. Get a little bit more done in a little bit. All right. We could probably break this up into 2 episodes, but let's get you back here and awesome. Great. We like to position our patients for success, and that's really what we're looking for. I'm gonna kind of take a look at her jaw again to see how it is. Yeah, lots more opening here, and then just this stuff's real sensitive. But I'm gonna go in here. Yeah, just kind of. First, I'm gonna kind of work externally and block, and then I'm gonna use my gloves. But
so now my right is fine.
You feel like the left?
It's tender on the left.
Yeah, so actually it's interesting when you start making things more efficient. Maybe she originally had left-sided jaw stuff, moved to the right, and then, because this got all locked up. Now we're unlocking the sediment here, and we're trying to improve the foundation. So, all right, go ahead and open a little bit, and right there. Back off. Okay, I'm just going to keep working. Go ahead. Just open, kind of meet that pressure. Good. And then back off. Good. Pressure on, pressure off. Yeah. So this is a lot of the fun stuff here we get to do. I expect those headaches to go down at least by 30-40% after the first visit. And then as long as she does the exercise I give her, a lot of the time it's posture. We talk about posture here, as well as how you sit. So she works at the front desk. Michelle works at the front desk. Come say hi to her. But where I'm always harping on how people sit, and all my patients get a lesson on that. You want to sit optimally. Everyone has different. It's not that classic 90 degrees sitting. Good. Now I'm actually going to go check here. I'm going to have you kind of clench down here. Just do some kind of like. I want to see the contact. Sometimes you try it again. Good. Yep. And so let's see on this side. The right side's a little bit. Yep, right there. And she's gonna love this. Do a little here. Hold right there. Good. Clench down. Good. There we go. And go ahead. Okay. All right. That's better. Good. Open. Okay, now I gotta block this some more on the left side. That's what she's feeling, the tightness, tenderness. Okay, right there, and back off. Yep, pressure on, pressure off. Good. Excellent. Very nice. Good. Open now? Yeah, hold. Open. Good. Yeah, good. Much better. What has to happen to the jaw is it's supposed to unlock and hinge. It's got to go unlock and hinge down, and then it goes forward. It should never jut forward. Anything that juts forward is dysfunctional. That will be your dysfunction. So we really want to track that for people's TMJs. Okay, good. We should post this on Instagram. That's what I was thinking. Good. Alright, good. Oh. Good. Alright. Okay, so now I'm going to go. How's it feel right now? Go ahead while I put on gloves.
Yeah.
Yeah, it feels pretty good, right? I'm going to get to the fun stuff, though. She's going to love me. Yeah. Wonderful. Good. So I'm going to take a look at her. Oh, sorry. And your safety is just, give me a wave and then I'll get out, or if you need to swallow. Good. So I'm going to take a look at her gums. Here, feels good. She's been going to the dentist. That's a great thing. Yep, we want to look for the health of the gums. Also, entryway for heart disease, and dentists really help take care of that. But this is not dentistry. I am trying to check for hard joints, just like I do for the head, and all that's related. So, right here, and go ahead and move your eyes side to side. And I should ask if there's any crowns I should be aware of. Okay, but, yeah, good. You can feel that tighten your bone, right? Guess what? Those nerves in the really can wreak havoc on us. Inside is called the intermaxillary line, and you'll see that a lot of people sometimes that have this dysfunction or sinus issues, it's really tight, and there's a little there's a little ledge, and so springy on this side, but hard on this side. I gotta kind of help that a little bit. So. There, block, and then go side to side with your eyes, or we can use your legs again. Go ahead and bend. We use these functional movement patterns adapted by the Institute of Physical Art. Good. Great. Yeah, people come in all over the world to see me do this. So, Brazil, San Francisco, Hong Kong. There. Good. You ain't going to see this anywhere else. Your local physical therapist doesn't know how to do this. You got to find yourself a functional manual therapist or come see me. Good. There we go. You doing okay? If you have a gag reflex, sometimes it's tough for people. We don't necessarily do this. I don't want to lose a finger. There's other ways around it, of course. This is just the most direct way. Yep. Of course. You doing okay? Breathe now, just quickly. Yeah, do your nose again. You can even see her ribs, her chest. How's that? Doing good? Yeah, let's see here. Yep, going. Yep, open. Good. There, so I'm really trying to get this side. It's been locked for so long. Good. And then I can really just sometimes even push here. Or actually I'll go here. Yep. Alright, go ahead. Yep, side to side. Right there. Tightens up. Yep. So sometimes people in a brain fog after car accidents really need a treatment like this as well. So there's tons of benefits to working on the head, the skull, the jaw, and you really, a lot more bang for your buck than going to a $900 chiropractic face adjustment. And it looks really interesting, but I don't know if it's for me. Or a little face mask that makes you improve the V of your chin. That was one thing I saw. You doing okay? Okay, good. I'm going to go into the muscles now and check out, kind of the things here. It's going to be this is usually the most tender. I'm trying to get to the disc here. So I'm going to have her here. And it's not fun. I'm going to have you turn your head here. Guess what? You're going to move your leg side to side. See what happens. Alright. And she's going to love this. Like I said. There we go. There's some cool stuff leading on here. And there's some interesting studies out there by Rockabada out in Brazil showing that the mouth and the core, the neck muscles, all these things, they all go together. It's such a fascinating new time. And you got to be on top of the research and also the manual techniques that are getting developed out there by the Institute. And we even invent our own here at Rehab and Revive. So come check it out. There we go. Good. Okay. Look at that. How's that feeling? Yeah. She's going to want to go eat whatever. What do you like eating? You like eating that? Yeah, she likes eating everything. But what's that thing that feeling turkey? Something like that? Yeah. It was just a little bit after Thanksgiving, and she went over to Anaheim, I think. Try some interesting food that's being created out there. Good. This one's really tight. I would say this is probably where her main dysfunction is. Open and close it. Yeah. Okay. Give you a little break.
That one is really bad.
Yeah, I could feel that your disc. The disc between the TMJ is trapped, and that usually can be very painful. So let me try to go again when you're ready. Yeah. Not to be done by your, like I said, just don't do this at home. Not to be done at home. Good. All right, here, good. Side to side with the legs. Great. Right there. You feel that tighten? Boy, that is a bad boy. Good. There we go. Starting to free up a little bit. Good. Now we're going to look at that jaw. I want the jaw to do two things. Jut forward and go down. So let's take a look. I'm going to tilt you this way. We're almost done. Yeah. Okay. So it doesn't go forward. You can kind of feel that. Just gently press against my thumb here with your jaw. Sorry, this one. Just kind of like, you're not going to bite me, but yeah, there you go. Good. 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 Now you're going to go open and close it now. Look at that. Come over to me. All right, the grand finale. Then we're going to kind of do some, and that doesn't go down. It goes forward. So right there. You're going to gently press into me. Good. There we go. Now it goes down. So you want to see that nice, go ahead and open and close it now. Look at that. Now she has to do exercises, so I'm going to teach her that, but stick your tongue in the roof of your mouth and try to do that. Yeah, open and close it. Yep, and you want to keep that in line. So that's the master plan for you. That's going to be your homework. Go ahead and sit up. Let's show the world what we have here, this final product. Let's kind of take a look. You can go ahead and we'll face the camera here. And yeah, let's take a look here. That's a little bit better. You can see the nose a little bit more in line. Let's open that mouth now. Yep. Yeah, pretty neat stuff, right? And then now breathe. Do the one-sided. Good. A lot more fuller. And then this side. Oh, look at that. You know? Yeah, smile now. Yeah, look at that. A lot easier opening. And like I said, when you do that jaw, go ahead and open it. It should go down and back instead of forward and whatever most people have dysfunction doing. But, you know, let's see how it enhanced her function. You know, I checked her range for her shoulder and really would love to see if it made any difference. And look at that. Boy, isn't that crazy? Did you know that was going to happen? I love showing stuff like this. Let's take a look. That's pretty amazing. That was like 60 degrees, right? I'm blocking pretty hard too. Look at that. All the way to her ear. That's phenomenal. I'm Dr. Justin Lin. This is Michelle. Thank you so much for watching this whole thing. I hope I get to see you. You can give us a call at 714-900-3880 or check us out on the web, rehabandrevive.com. We're located here in Tustin, California. Thanks very much.